Understanding the distinction between binge eating and overeating is essential for recognizing problematic eating behaviors and seeking appropriate support and treatment. While both involve consuming large quantities of food, there are significant differences in the frequency, intensity, and psychological factors associated with each. Here's an overview of the differences between binge eating and overeating. Binge eating. Binge eating disorder is a serious mental health condition characterized by recurrent episodes of uncontrollable eating, often accompanied by feelings of guilt, shame, and distress. Key features of binge eating include loss of control. Individuals with binge eating disorder experience a sense of loss of control during episodes of binge eating, consuming large amounts of food rapidly and feeling unable to stop or control their eating behavior. Emotional distress. Binge eating episodes are typically driven by emotional triggers such as stress, anxiety, boredom, or sadness. Food serves as a coping mechanism to numb or alleviate unpleasant emotions, but the binge eating ultimately leads to increased emotional distress. Frequency and regularity. Binge eating episodes occur regularly, often at least once a week for 3 months or more. Individuals may engage in secretive eating behaviors to conceal their binge eating from others. Psychological symptoms. Binge eating is often associated with negative psychological symptoms such as low self esteem, depression, anxiety, and body image dissatisfaction. Individuals may experience guilt, shame, or self loathing following binge eating episodes. Overeating. Overeating refers to consuming more food than is necessary or appropriate for satisfying hunger, but it does not necessarily involve loss of control or emotional distress. While overeating can occur occasionally or in response to specific situations, e.g., social gatherings, holiday meals, it does not meet the criteria for a diagnosable eating disorder. Key features of overeating include lack of loss of control. Unlike binge eating, overeating episodes typically do not involve a sense of loss of control or the inability to stop eating. Individuals may consciously choose to eat larger portions or indulge in high-calorie foods without feeling powerless to stop. Occasional nature. Overeating may occur occasionally in response to external cues, such as food availability, social pressure, or emotional triggers, but it does not occur with the same frequency or regularity as binge eating episodes. Less severe psychological distress. While overeating may lead to temporary discomfort or guilt, it generally does not result in the same level of intense emotional distress or negative psychological symptoms as binge eating. Individuals may resume normal eating patterns without experiencing prolonged feelings of guilt or shame. Treatment and support. Both binge eating disorder and occasional overeating can benefit from treatment and support to address underlying emotional issues, improve coping skills, and promote healthier eating behaviors. Treatment options may include psychotherapy, e.g., cognitive behavioral therapy, nutritional counseling, support groups, and medication in some cases. In conclusion, while binge eating and overeating both involve consuming large quantities of food, they differ significantly in terms of loss of control, emotional distress, frequency, and severity of psychological symptoms. Recognizing the differences between these behaviors is crucial for accurate diagnosis and effective treatment.